Maria is 36 weeks pregnant and brutally honest about what the experience has really been like.
The books are all like, oh, this is beautiful and all this other stuff. And it's not. I have not enjoyed being pregnant.
But behind the humor is something deeper.
It's exhausting to be pregnant, and then it's exhausting on top of it to advocate for yourself as a patient.
But she took control, tracking her labs, questioning her care, and discovering just how easily serious issues can arise. And the one mistake in her medical chart that left her stunned.
That could be fatal for me.
Today, our special guest is Maria Silvestri. We're going to ask Maria about her personal journey with blood health during her pregnancy and how she's planning for continued blood health into the postpartum, or what they call the fourth trimester of pregnancy. I love that, the fourth trimester. Everybody deliver the baby and nobody thinks moving on. It's so nice to have Maria here. I speak to all the doctors and the nurses and the pharmacists, and it's wonderful to have a patient perspective, right? This is fantastic. Thank you for joining us, Maria.
Thank you for having me today. Marianne and I are friends in real life, but in this context, I am a 40-year-old pregnant person that is about 30. I have to look because I can't remember. I'm 36 weeks pregnant. We've been going through this journey a little bit, and I have said to many people, Marianne is the only person that was honest with me before I got pregnant about what pregnancy would be like, because the books are all like, oh, this is beautiful and all this other stuff. And it's not. I have not enjoyed being pregnant. Then Marianne would be like, have I told you my favorite thing about myself today is that I'm not pregnant? This is terrible enough, but thank you. This has been like 8 months of a journey. The last, I would say, a month and a half has been a lot more focused for me on my blood health, the ways that I've advocated for myself as a patient during this pregnancy. It's exhausting to be pregnant, and then it's exhausting on top of it to advocate for yourself as a patient and to get the type of care that is possible, but hard to achieve because medical professionals see a lot of people and they're just trying to get through their day like the rest of us sometimes.
I want to tell you, you should not feel bad about not liking being pregnant. I was pregnant 3 times. I love my children dearly, more than anything in the world. Each pregnancy was worse and worse. One was worse than the other. I felt guilty saying, I hate being pregnant. It's real life. It's realistic. It's a hard thing. Your body is doing something that many people cannot do. We're grateful for it, but it's not easy, and it's okay to not enjoy it, just so you know.
You're very fortunate. You have an excellent support system. You're near a major medical center. You're a very articulate, intelligent woman. And this is a lot for anyone. If you could share with us your struggles as a patient, I think this would be very affirming for many women out there.
I'm very fortunate that I have an amazing family support system and very good health insurance, which has given us a lot of resources, including a virtual doula, in real life doula, virtual lactation consultant, in real life lactation consultant. Because we live near a large university hospital system, it tends to be my preference, and also my husband's. We both generally go to the academic practices because we are in a position as patients to help people learn. So let's do that. In my case, if there's one person staring up my whatever cavity, like, what's another one? We're very resourced in very ideal ways. Everything that I've asked for that we could say like extra during the pregnancy, I've gotten right away. I've also been doing pelvic floor PT, which to me is related to actually the blood management part of this in a way. In addition to everything, huge amounts of consumer education from the hospital system. Pretty much every class that they offered about pregnancy, we have taken in some way and made our parents take. You want to hear a bunch of people whine, tell your parents to take a grandparenting class. Also, I do prenatal yoga. One of the big ways that I've been preparing is like by doing a lot of movement work to get my body ready. But then I love the science part of this, right? So I'm like, please take more blood. Let's learn. I love looking at the lab work results and being like, what's going on here? And what can this lab work tell me about where I'm at in this? In a lot of ways, that's where the journey with the blood health began.
And one day I said to Maria, what's your labs like? How's that going?
Yeah, here's a screenshot with a trend line, because I like this part of it. I'm always like, hey, let's get my baseline. Let's learn about me. Then we can see what happens. I love quantifying my body. Like, this is something that I just enjoy. For example, a couple years ago, I was having some trouble sleeping. I put on a Fitbit and went into the doctor with a month of sleep tracking, just with even a Fitbit years ago. Turns out my ex was like a total jerk, and that's why I couldn't sleep. But she was like, can everybody come in with a month of data before they see me? I like to do that because to me, that's a way of creating something productive for myself and the medical provider. I was more than happy to send screenshots of my blood work immediately because I love the app that my health system provides, and I use it all the time. And in fact, I have it open here for our talk today so that if you have specific questions about my hemoglobin, I can answer them also. I don't know what it means, but I'll tell you what it is. I did send Marianne some screenshots because she has been doing valuable patient education with me throughout. Part of that was, ask for a full iron panel because this is not looking so great. And I did. While there have been some hiccups along the way where I've felt like I've had to really advocate in ways that were to me really annoying because it just took energy. No, I'm not a medical provider. No, I'm not like a medical professional, but I can read. So can you just treat me like a human being and not the next in the line of patients that you're seeing today or this week? They did the full iron panel immediately. What also set this off, which is also, I think, very related to blood health in some ways, I had to do the 3-hour glucose test, and it was not handled well. I didn't receive adequate information before the appointment. So I was calling them saying, hey, do you want me to be fasting before this? That makes a difference. They didn't give me that information until I called and asked for clarification. At the 3rd hour, they were like, hey, do you want some apple juice or something? And I was like, no, I'm fine. Then I wasn't feeling great. So I went to the hospital cafeteria to get some chicky tendies. And I felt myself getting really clammy in the back of my neck. And I was like, oh, a good place to pass out would be this hospital cafeteria at lunchtime. So I had some chicky tendies and a Snickers, found a protein bar in my car, and drove to get my haircut. And at the end of the haircut, get this frantic phone call being like, hey, are you okay? And I'm like, now I am, but I'm like going to get more food now. And she was like, oh, because your final test was like, your glucose was 40. As I was driving to my haircut, I was talking to my husband who said, oh, you really don't sound well. And I'm like, I'm fine. I've been in situations before where people had really low blood sugar and didn't know that they sounded weird. And I experienced that while I was driving a car in a city. This was tremendously unsafe. At no point did anybody say, hey, have somebody take you to this test. Things could happen. So that set me off. The next 2 appointments I had at my OBGYN, I was like, hey, you guys handled this terribly. And this was unsafe for me. This was having this like very low blood glucose was like the most dangerous part of my pregnancy so far. How dare you? Right. If I remember correctly, Marianne, that's when you started, how's your hemoglobin? What happened is because I was so borderline on the blood glucose, I think once I got a test that was just above 11, it was like 11.1. They were like, okay, you're fine. Meanwhile, Marianne, we start treating for this at 11. You should be like looking at this.
Yeah.
So that was patient education that I got from Marianne, which then later that has started the specific journey that I've been on. And not everybody has Marianne like personally in their DMs, which is too bad because this is something that I think is not at all addressed.
Yeah. Underaddressed. Definitely underaddressed.
Nobody would have ever brought it up if I hadn't.
That's unfortunate.
How did that make you feel? You're a very savvy person. It sounds like you really are an advocate for yourself. A lot of people don't always feel that way. They don't feel as confident as you are. When you found out about this hemoglobin and the kind of lack of treatment that you had received, did you feel empowered? Did you feel angry? Did you feel confused? How did it make you feel?
This whole process has been a lot of education, right? Not just about my blood, but also about like various aspects of pregnancies, in addition to this education about my blood health. And then there's also just been regular consumer education. We're taking classes, and 80% of families don't take any class before they have a baby, right? There's amazing consumer education available, which is also extremely underutilized. If 70% of women are going into this being like, hey, I would just like to be induced and have an epidural and forget that this ever happened, then I think medical professionals that delivers over 15,000 babies a year in multiple practices is treating for a lowest common denominator. So my feeling is like, don't tell me that every pregnancy is different and then treat me like everybody else.
Oh, good point.
It's like super insulting, actually. Who wants to hear that? Like from a clinical, if you're sitting on the other side of me, who wants to hear that? But it's the truth.
Your hemoglobin wasn't terrible, but there was no further investigation into how are your iron studies. If your iron levels are low, if your storage is low, when you do bleed, and with pregnancy, it's not if you're going to hemorrhage, it's how much, right? This is going to happen. And as you progress through the trimesters, your body's going to need more and more. That baby's sucking everything out of you, right? You're going to have a higher need for iron and hemoglobin to get through and feel better. Being anemic during pregnancy has problems for both you and for the fetus. There's well-documented short and long-term consequences, as we discussed during delivery. What if you have massive bleeding then? What then? What if you go home and your hemoglobin's 6? Then you're like dragon tired, and nobody wants that when taking care of the beautiful newborn.
I would say just there's a few things that kind of got me to this, the place of like what the iron panel showed, I think. During the second trimester, I was traveling for about a month, and I was extremely non-compliant with my prenatal vitamins, which had I not been, probably this would not have been even such an issue. Also, with the virtual doula, it was great because she and I were able to spend time together working on the birth plan, so that then with the in real life doula, we're talking about enacting that. When Marianne asked me about my birth plan, it was like, there is nothing here besides on the ACOG birth plan template, which is basically what I was using with a few more things.
And that's fantastic. That's the American College of Gynecology and Obstetrics.
They have a really good, their website's excellent for like all kinds of stuff. And one of the things they have there is a birth plan. That was the template I was using. The only thing on that about blood is what your blood type is.
That's interesting.
So the doula and I were talking about the birth plan. And also, once I got home from this extended travel, I was beginning to do a lot of movement work, PT and yoga, plus stuff in between at home during the week. And I was really sore. So this is not pleasant which now I know is probably because I was not necessarily optimizing the oxygen that my muscles needed. And this baby is also sucking all of the iron out of me that I put in it. I immediately started to get much closer to 100% compliance with the prenatal vitamins. And I've begun supplementing with iron about every other day. It's challenging because I want to take it on an empty stomach in the afternoon with some orange juice. This is hard in my life to achieve because also in an effort to cut back on the constipation that iron can cause, because as a pregnant person, I have discovered the magic of laxatives. I don't want to be using them all the time. They're amazing, but that's not something I want to add. I feel like in general, as a person that prefers kind of low intervention, I feel like I've been taking a lot of pills, even though those are mostly supplements. But I feel like I've just been taking pills constantly throughout this pregnancy, and that's not something I like. So I'm taking a liquid iron supplement. which I think has helped. It doesn't feel so bad and it's not really hard on my stomach or body, but I have been feeling better and I have been feeling a lot less sore. It's a little bit too early to do a follow-up iron panel to see where I'm at, but I'm hopeful that is improving. As I started to read a little bit more about it, I don't want to go into the postpartum anemic, and I have told my providers this. Now, the extent to which that's going to stick is unclear. Also, I do prenatal yoga with the teacher happens to, during the day, be a maternal and fetal medicine doctor. At one point, when talking about this, she's, let me see your labs. So I showed her the same things that I showed Marianne because it's on the phone anyway. She's, oh, that's what my iron levels were when I was pregnant. The other thing that I think I've learned from this is talking with OBGYNs and maternal and fetal medicine doctors are often women will say that they go into this because they really care about women's health. And I believe that. But I think that nobody is, but what if this could be better? What if my health during pregnancy could be better? With so many other things in life, there's all these little like switches you could flip and little things that you could do that could optimize the situation even just a little bit more. We started this conversation with me being like, hey, I'm not enjoying being pregnant. So if this is the switch that we could flip that could make me feel a little bit better, a little bit less sore, support my goals for my body with all the movement work that I'm doing, and set me up for a better postpartum experience, then why is this not part of my care? And it is only because I've been really advocating for it.
It seems like you had to dig deep and you really had to look for stuff. And you had mentioned that the iron, even if you took your iron religiously, iron is very difficult to absorb. It's very difficult with the complications that you have, like the digestive issues you have in pregnancy. I don't think you should feel bad about that. But just to note too, like you said, every other day is a good policy. It does help with the constipation and the nausea. And there are several different formulations of oral iron that people can try. So if one doesn't work for you, maybe trying a different type. Also, the orange juice. You checked all the boxes. You know exactly what you're doing. But not everybody hears all these things. It's one of those issues that I believe medicine and physicians, there's so many other things that take priority over this, even though your blood is the center of all of it. It's unfortunate that sometimes it takes someone to like really push it before anybody does anything. So I'm glad to hear that you are doing that, but we definitely need to change this. It needs to be more of a focus. Not everybody comes to the table with as much information as you do, and that we're doing them a disservice if we're not helping them with that.
Even mentioning blood and blood management took me on a little detour. I think that just from talking with Marianne over the years, this is a positive thing, but then it got weird. Seems to me that when I started talking about blood at more than one appointment, I had some patient education with a nurse, and she was really incredible. She's been doing this for 40 years. They brought her into the practice specifically to do what she was doing with me, the patient education stuff. She was like super incredible about it. I said, hey, I have a friend who's this internationally recognized expert on patient blood management. And let's also talk about where this fits into the birth plan. If you haven't guessed by now, I go into every appointment with a birth plan on my iPad and make little changes like throughout. She was like, oh yeah, I don't blame you. I would not want to receive blood or blood products either. Why don't I give you a referral to the bloodless medicine? So on one hand, this is a win, right? This is what you collectively spend your careers advocating for. On the other hand, this was a detour as a patient that I did not expect. And then some of the results of that have also been a little bit weird. The health system where I receive my care, the bloodless medicine first contact is an advocate who is not a medical professional. So it's her job to be like, okay, and here's where I'm going to direct your call, which is good. They were very fast about this. Also, I'm like, hey, I am not doing this for any religious reasons. I am doing this because this is how I want to manage my health, which I think is important to clarify. everybody's supportive of this, right? It seems to me like medical professionals know this is not necessarily a great way to go about things if you don't have to. So I was referred to a maternal and fetal medicine doctor who I met with, and she was really supportive. She explained to me the hospital's protocols, what they do in the event of a hemorrhage during labor and delivery. She was like, listen, blood is like our last thing. Like we have 5 other things we will do first. We hear your desire for beginning with lower intervention and working your way up to a higher intervention technique, let's say. This is totally fine. And I was like, great. I don't need to worry about this because that's already your protocol. Wonderful. We were able to talk about a few other things related to the pregnancy, which was also helpful. But this hospital is very big into a 39-week induction. Yeah, like when I started practicing, we really didn't do much with it. But now we're just like, the pendulum has swung the other way. So like, we probably are over-inducing at 39 weeks, but like nothing good happens after 40 either. And these people are talking out of both sides of their mouth, and how that is related to, I think how that's related to patient blood management and like my blood health during pregnancy is because this inductions are a slippery slope to an increased need for C-sections, which is then when things can get ugly and blood gets to be a thing, even more so than a regular delivery. And so that makes this conversation all the more important.
Do you feel that it's almost like two standards of care, like the people that are bloodless and everybody else? Like, why are we not preventative and identifying, diagnosing, managing anemia as we go along? We should be doing that and not just, oh, you don't want blood, we're going to go a different route. Do you know what I'm saying?
So that's hard for me to answer because this is the first time that's ever come up for me. But in the last week, I had an appointment that was a regular appointment. It started with a resident, and she was like, okay, the doctor will come in shortly. In between that time, her notes showed up on the app. I review the clinical notes after every appointment, and there was enough of a wait that it popped up. I got a notification on my phone. It said patient refuses blood or blood products. So now a doctor who had a greater than 0 chance of being involved in my labor and delivery, the first thing I have to say is, holy shit, your resident just screwed up and wrote something on the clinical notes that was completely wrong. This is my first interaction now with this medical provider who otherwise actually has like this incredible reputation. And she's, oh, I'm like, that could be fatal for me. When did I ever say this? Now, like it's written in the clinical notes that patient refuses this, when according to Marianne, I might be hemorrhaging out. Great, thanks. Like I didn't get blood when I wanted it. That's the challenge here.
This is what I'm saying, because there's this group of people and that group of people. Like we should just be going in and treating everybody, optimizing like where we can, building them up where they can and getting them to a point. With these two different ways of approaching patients, it gets confusing, and it did. It did.
Thankfully, we were able to fix that immediately. On the other hand, 2 things going on here. I'm very focused on advocating for myself. It created a little bit of a barrier with the medical professional who I really respect. That's not the foot I want to start off with the medical provider, right? At all. This is a conversation starter about what my preferences for treatment are, but not in a positive way. Like I've said many times, this is the sort of thing where when I ask for the type of care I want to receive, I'm getting it immediately. You want a referral for this? Here it is. You want a referral for that? Here it is. Great. Clearly, everybody's looking at my entire chart here and seeing what I've been doing and seeing who I've been talking to. And that's a really positive thing about how my care is managed. I think that's better. It's less siloing, but there's still a lot of that.
I think, honestly, The rates of mortality in delivery and pregnancy are still quite high, even in our country. This is part of it. This is part of the reason because we are accepting a level of care and of hemoglobin and of blood levels in women and iron levels in women that is unacceptable prior to major event in their life and possible major procedure. We optimize
Mhm.
patients for cardiac surgery better than we optimize pregnant women right now. I don't think it's intentional, but I think it just hasn't, until recently, been a priority. I think the tides are changing, but it does take a lot of time. Unfortunately for you, you had to advocate for yourself, but you also have a friend that's in the business. I'm really happy that you came here to talk about this, about your experience, because other people are in the same boat you're in, but maybe they don't have the same connections or have had the same or the same level of ability to see these people and access to healthcare. Like that's a huge buzzword right now. But even if you have access to healthcare, if you're not getting the proper healthcare, it's not doing you any good.
I wouldn't say I'm getting bad treatment. I think it's just that it's a case of volume. And I think that's something that's not different based on access to care. I have incredible access to care, but there's such a high volume of patients that makes it challenging. I think that's what happens in places where there's less access to care. That's why it's probably even worse, right? If I had to summarize the way that I've felt that my experience has been throughout this pregnancy with the medical providers that I've had, it's been, we will listen to you, but also let's just make sure that there's nothing really wrong. That's it. If I was going to also been using this really amazing template for a birth plan in general, what are some pregnancy specific plans for blood management as a pregnant person? Because that conversation could even be possible as a layperson to know what to even ask. It would be like super helpful because no, not everybody has a friend saying, hey, get a full iron panel done right now. This doesn't look really good.
Telling stories about chainsaws.
Yeah. Did somebody say chainsaw? Do you want to throw down some fun facts about chainsaws, Marianne?
Yes. So the modern day chainsaw was invented to aid women with delivery of babies. That's a true story. I love that. Thank you. That was, I can't believe you found and brought a chainsaw. Our first chainsaw,
I thought it was appropriate.
baby's first chainsaw, but it's true. Like back, and this isn't even that long ago, maybe 100, 150 years ago, I forget, but the version of what is now the modern chainsaw is what was used to help expand the vaginal canal to deliver the baby. It's honestly, it's not a bad idea, but it sounds absolutely horrendous, right? And terrifying. And my God, we've come a long way, baby, right? And we're still continuing to come a long way in maternal care and medical care. And this is the point. We know, as Maria so eloquently stated earlier on, we know that Maria is not in a bad position. She's not a hemoglobin of 6 or 8 even. She's flying around 11, but probably going to drop as she goes on and definitely going to drop when she delivers. We should be really, patients should be zoning in on that and seeing where they're at so that they're in a great state when they do deliver. We just want to do what we can to avoid that.
You're headed towards a pretty wonderful time, but a difficult time. If you are already a little tired, you want to be at your best. You want to be at fighting weight. You really need that energy to get through that period. As much as pregnancy is difficult and your body is under a lot of stress, it's equally difficult once the baby's out and wonderful in a wonderful way, but it requires a lot of energy, a lot of time, a lot of focus. And you also want to be the best you can for your child. So it's really important.
What's your plan for after delivery?
I would say right now, my plan is actually to not change very much from what I'm doing right now, meaning continuing to take prenatal vitamins for at least a while to do the iron supplementing the way I've been doing, continue the physical therapy and the movement work. I think that that's all stuff that will set me up for success, minimize post-pregnancy complications, including postpartum depression. And so my goal is right now to actually continue doing most of what I'm doing and not just be like, I had the baby, so I don't need this anymore, because clearly, like, we've just been through it. From what I understand, there's a lot of stuff that I can be doing to optimize my body for success so that I can take really good care of baby girl child, which is always the goal. I don't know that the recommendation to continue taking the prenatal vitamins isn't something that I think seems to be discussed very much. I still need all of this stuff, and it can really help with a lot of the things that we expect to have happening. But that's my plan for the moment.
What would be your recommendation to a healthcare consumer who either is thinking about getting pregnant or is pregnant? How do you start this conversation with your doctor if they don't initiate it with you?
Oh, I am not immune to the algorithm. Currently, actually, I don't even want to be like looking at Instagram reels because it's all about being pregnant and like I have other interests in my life. But what I have done is when there's something that resonates with me that I do see in a short form video, for example, which, let's be real, this is where most of us are getting weird ideas anyway. Also, the only 2 pregnancy books I bought were from the Mayo Clinic. So my way of doing this is, hey, I'm presented with this weird idea from the algorithm. What are the resources that I have in real life with my medical provider to achieve this, and talk about it and learn about it from them? Often they've been like, hey, that's a great idea. Let's do this. So the best advice I would say is use the resources that are available, because there's actually a lot. Like I said earlier about the consumer education that is provided for pregnant people and their families. This is so underutilized. And that has been some of the most empowering moments of the pregnancy have been, hey, this is what you should and can ask for. The answer is going to be no unless you ask for it. That's my biggest advice. Take advantage of the people in front of you who want to help you so badly. You know, they really do want to help people and they want to share what they know. In the case of a large university medical system, these are people that are like at the bleeding edge of their field. They're really equipped to be helpful. That's the advice. It's not, oh, go be like very concerned about your iron levels. That's not my advice. My advice is to like take advantage of the human resources so that you can feel empowered to advocate for yourself, get the kind of care you want. And when that includes blood health, go for it.